Okay, so we are starting, this is still in chapter 28. We're starting with isolation, infection control isolation. So if you look in your text, that starts at towards the bottom of page 471, and it starts with isolation and isolation precautions. Okay, so that's where we're going to be at for this. All right, I'm going to have to actually do it. Yes. Okay, so for isolation, that's basically direct from your book, but basically in roundabout-ish 2007, CDC made a bunch of updates and the way that we need to comply with, or what the standard and isolation precautions would be. Standard precautions are basically the same, but the way in which we need to implement isolation precautions for certain patients, depending on what disease process they actually have, okay? All right, so there's a two-tier system that the CDC has developed. The first tier is basically standard precautions. And when we're talking about standard precautions, that is precautions that you implement regardless of what the patient has. Okay, it doesn't matter what they do or do not have. These are precautions that you're going to implement all the time anyway, okay? So, used when caring for all clients in any setting, regardless of medical diagnosis. So these are things like washing your hands, right? Using good judgment when you need to put on gloves, maybe masks or eye protection, or even possibly a gown. This is directly from your textbook, and this is on page 469, I believe. So you'd actually have to flip back a page from where that starts. And this is basically goes over that tier 1 standard precautions and when you would need to maybe utilize each of that protective equipment that I just mentioned, okay, our PPE, right? Personal protective equipment. So that'd be like gown, gloves, mask, maybe an eye shield, or goggles, depending on your institution and what we're dealing with. So this kind of goes through that, and maybe what diseases that you would see or need to use those within, but those are just different types of PPE that you would implement. And we're going to kind of go through some of these as well. So the first tier standard precautions continued are PPE, or personal protective equipment. So that's our gloves, mask, gown, and eye protection as mentioned. And you're basically just wearing those anytime you think there's potential of coming in contact with either secretions or excretions, okay? There's a difference in the in both of those, but they're produced by the body, okay? So excretions is basically you want to think about as maybe waste removal from the body. Secretions are actually things like enzymes and things that are movement from maybe point A to point B that happen within the body. Either way, if you're coming in contact with any one of those, you need to be using nursing judgment as to which type of PPE equipment you should be placing on, okay? So examples of that would be blood, maybe all body fluids, secretions, and excretions as mentioned, non-intact skin. So that could be maybe if the patient had a wound, right? Or a laceration, surgical wound, anything like that. And then mucous membranes. This is just a little sign basically I typed up that kind of goes through performing hand hygiene, what hand hygiene is, when you would implement it, and then just some brief good information on gloves, gown, and wearing protective eye equipment. But really, if you review that grid on 469, it does help capture some of that information as well. But we're going to go through these. All right, so our tier 2 transmission categories. So the first one it talks about is airborne precautions. And these are droplets that are less than 5 micrometers, okay? So basically the smaller the droplet, the further it can actually travel. All right, so with those, you might see patients, or not might, but you're gonna see them actually put in maybe a negative pressure room, their own isolation room. And those are patients that you're gonna have to wear like the N95 mask that you guys are getting fitted for. Okay, tiny molecule can travel further. So examples listed here are chickenpox, measles, pulmonary or laryngeal tuberculosis. That's what TB stands for. So they're going to go in that private room with negative flow. Negative flow basically means like if you were to open that door, that pressure sweeps and goes back into the room instead of being blown out, right? So we want everyone else that could contract basically what those tiny molecules have within them. Droplet precautions. So these would be molecules greater than the 5 micrometers. Those are bigger molecules. So they can't travel as far as a distance, okay? So diphtheria, streptococcal pharyngitis, pertussis, mumps, those are just some examples of those disease processes, which are also included in that grid on page 469 that you're going to want to look at. And what they try and do is, depending on the disease process, and more so with droplet precautions, okay, not airborne, droplet precautions, they may try and room those patients together if they don't have availability of those isolation rooms, as long as they have like disease processes with the droplet, or maybe even a contact precaution you'll see. All right, so moving into contact precautions. This is direct client or environmental contact. So they could be maybe colonized or infected with, have you guys heard of like MRSA? That's probably a super common one in the hospital setting, right? That can colonize in the nose, in the nares, right? It can also colonize on skin. So that's something you might see more so often. And most patients that come from skilled facility that go into the hospital setting, they'll screen for that as well. Private rooms are clients with light diseases. So that's where it's basically those standard precautions of maybe gowns and gloves, depending on what we're dealing with. C. diff is another fun one, right? You guys have dealt with or heard of C. diff. We're going to talk about that a little bit as well as we move along. So these are things that when you guys are in the hospital setting, that you're going to want to look for, okay? Because any patient on some type of isolation precautions, there should be something that notifies people going into that room what type of precautions they're on, so you know how to gear up before you go into that room, right? It's going to be different depending on what disease or pathogens they have. So you're going to look for signs that maybe say airborne precaution or droplet precaution. And then when you see that, I'm going to want to know what it is. So I want to go look at the chart, see what the heck's going on, so I know how to protect myself or the patient going into that room. I know Debbie mentioned, she made a comment about patients who are immunocompromised and the type of isolation we put them in. Normally what we actually call that is reverse isolation, okay? When a patient is immunocompromised, we're not worried about what they can give the world. We're worried about what the world can give the patient. So when we go in, we might put gloves on, a gown on, maybe even a mask on to protect that patient from getting any type of bacteria or microorganisms or contracting anything that we might be able to bring into that room because they're so immunocompromised. So that's called reverse isolation, okay? So you're gonna wanna look for that too as well when you're looking at charts or signage on the door. COVID-19, guys, that's been a fun one, right? So you guys kind of came at a good time. I don't know if any of you are, any types of healthcare workers like CNA, care partner, or whatnot that are in the hospital setting. But let me tell you, our world changed when this hit. We went from being completely bubble wrapped to it's a little more slightly lax, but I don't want to say lax. Lax is probably not the right term for that. But the CDC or OSHA recommendations is that we are wearing eye protective equipment, that we're wearing masks because we're worried about both droplet and airborne, right? We're also worried about contact, okay? So standard precautions, contact, eye protective equipment, airborne and droplet is what we're looking at. So basically your N95 kind of covers your airborne and droplet. A regular face mask, like a regular surgical face mask, those are droplet precautions because those are bigger molecules, airborne and N95. So what I want to remind you is when you're going into the healthcare facilities, you're going to basically gear up based upon whatever that facility's protocols are. And wherever you go, the protocols might be slightly different. So don't assume because maybe you've worked at Adventist and now your rotation is at Dignity that you know how to gear up and go into that room. Make sure you have read and understand and you talk with your clinical instructor with what it is you need before you go inside that room, okay? Right now, the last time I was at Dignity is who I'm at. I normally take my students to my old stomping grounds, which is Mercy Truxton. And right now, just in the nurses station, if you're out and interacting with patients who are not COVID positive, it's basically you're wearing a mask all the time, always, right? A basic surgical mask. And then they were making us wear goggles, but that went away. So I don't know if it's come back in the month or so that I haven't been back there. So we'll see. Or they have, for those of you that are wear glasses on Amazon, quick little tip, you can buy these little side shields that slide right over your lenses here, or right by your lenses here, goes over your earpiece. And what they want is your eye enclosed this way, right? So if you buy those and slide those on, those will actually suffice. So you don't have to put goggles on over your glasses, which is what I was doing until they gave us the okay for those. All right, so let's talk about the psychological implications of isolation. So could you imagine being stuck in a room staring at four walls all day? Some people are lucky enough to have a window, some people are not, right? You don't even have a window, you might not even know what the heck time of day it is. You can only base it off what's on your tray, right? Oh, that's breakfast, must be morning, right? So can you imagine how that must feel, especially maybe someone who's super active, right? Does things, go out, sees people, maybe has a job or other types of social activity. So you want to think psychologically how that is going to affect a person, right? So we talk about holistic healthcare, right? We're not just treating the disease process, we're treating the person. So you want to make sure that that also is inclusive of their mental and emotional well-being, okay? So you might see loneliness. Those normal social relations are disrupted, and maybe even altered body image. So they might feel unclean. I mean, I don't know about you, but even just having had kids, just the short duration you're in the hospital and you have a baby, you're like, I want to go home to my own bed, my own shower, where all my stuff is at. You don't even want to really touch anything, even though it's supposed to be a clean environment, right? So just that alone, you need to think about. So they might feel unclean, rejected, maybe even lonely or guilty. Why do you think they would feel guilty? What would make a person feel guilty for being in the hospital? You're sick, you need to be there. If they have loved ones or family that they take care of, right? Maybe you are the breadwinner and you're not home to make the money and go to work. So would you not maybe feel guilty that you're not taking care of business as usual because you're hospitalized, right? So those are things to think about, especially with men. Those are things to think about with our male patients, females as well, but men tend to have, that tends to affect them a little bit more. Just things to think about. All right. So interventions, we can teach the client and family how to prevent the spread of disease. This is super important when you have patients on isolations, because nothing irks me more than family members or visitors. They just walk right in there, not geared up for anything, and they're just going in, they have no idea what's going on, or maybe they do, but they're not really following the process well. So it's super important that we're paying attention when any type of visitors come to see the patient, and that we're educating them on how to properly put on what equipment they need and to take off what equipment before they come out of the room. Okay, depending on the type of isolation, right? If it's airborne, they're not taking that mask off until they're out of the room, but they wouldn't know that unless you educated them. Do they need to be using hand sanitizer, or do they need to be washing their hands, or a combination of both, right? We need to educate them and the patient. So maybe a patient sees a family member coming in, they can be like, you need to talk to the nurse first, right? Provide sensory stimuli and deliberately plan time to see the client. So they're on isolation. I'm going to tell you, it's not fun to gear up with all that stuff on. You're like, oh, isolation patient, because it's more time out of your day, right? And it is extra work, but we're there for a reason and they need us. So you want to make sure you're not purposely ignoring or kind of putting off going into that room because of maybe the extra work it takes to gear up and go in there. So you need to purposely set aside time to go in there, talk and converse with your patient, and not just about their disease process, their people, right? Hey, does your family come to see you? You have any visitors coming? What are you looking forward to when you get out of the hospital? Things like that. Have that conversation and get their mind off of being stuck in that room and maybe what's going on currently in the hospital. The biggest thing we're trying to do is prevent depression, right? All right, hand washing. What did Debbie say about hand washing? Right on the screen. Most effective way to prevent infection, and that is the most effective way for breaking the chain of infection. Did she talk about the chain of infection? Ooh, she didn't play the video, huh? I have an awesome breaking the chain of infection video. I'm going to post it for you guys. If we have time, I'll pull it up. It's pretty awesome. So yes, most effective basic technique in preventing and controlling the transmission of infection, just simply washing your hands. We got to educate patients and family about that as well. All right, super important that we're washing with soap and water. And when we are doing that, we are doing it when our hands are visibly soiled, right? If you see something on your hands, wash them. We do talk about time here near the end. We talk about when you can utilize the alcohol-based hand sanitizer. But I don't know if any of you that have been in the hospital setting, you use that sanitizer a few times, you get that weird funky film on your hands. Go wash your hands. So clean your hands too. Wash those hands with soap and water when you start feeling that weird film. After known or suspected exposure to Clostridium difficile or C. diff, right? You cannot use an alcohol-based sanitizer after leaving a room with a patient that it has C. diff. You have to actually use the friction of washing your hands with soap and water to get rid of those pathogens off your hand, okay? After known or suspected exposure to patients with infectious diarrhea during norovirus outbreaks, that normally has, they have like nausea, vomiting, diarrhea, those types of side effects. You might get that from like contact with surfaces that maybe have come in contact with that particular pathogen, or food that has been contaminated with it, or maybe a patient who's actually been, direct contact with that patient as well. If exposure to Bacillus anthracis, which is anthrax, is suspected or proven. And I used to be the big scare in like early 2000, right? I've not really even come in contact with a patient who's really had it, but just so you know, before eating and after using the restroom, yes, please wash your hands, soap and water. Use an alcohol-based hand sanitizer for everything else. You can. So sometimes maybe when you're leaving a C. diff room, there's not a sink like right there, right? So if I take off my gloves, maybe I'll pump some alcohol sanitizer really quick, but I'm going straight to a sink, right? I'm not like, all right, I'm good, and I'm going about my day. So I'm going there straight to a sink. Depending on the room, you might have like that, you have a smaller room where there's a sink right before you leave the door, go outside the door. You could wash there, but even in my head, I'm thinking someone still touched the door handle, and I'm probably going to want to wash as I come out completely. All right, private room is ideal. We would prefer that patients who are infected with something that causes them to be in isolation, that we are putting them in a private room by themselves, but that's not always the realistic situation, depending on how many patients we have in the hospital. So we might basically house them or room them with a patient who has a very like disease process. That is mainly contact, okay? If possible, avoid taking any reusable articles or equipment. The beauty about today's technology and things that we use in the hospital, a lot of things are disposable or one-time use now, but the machines that run those are not, right? So like your blood pressure cuffs, they stay with the patient. We normally just wrap them around, because they Velcro, wrap them around the railing on the bed, and then just put them back on the patient when we need to use it again. But that tubing hooks to a machine that you push in the room, right, to take their blood pressure and their heart rate and their temperature. So we want to make sure as we're leaving that room that we're wiping everything down and cleaning it really well before we move on to the next patient, okay? Use disposable items when possible, whenever possible. I think one of the bigger tips I can give you too is task as many things as possible when you go in that room. And when you go in that room, it needs to be purposeful and intentional, right? So if you're going in that room, maybe just to take vital signs, you need to make sure you have everything you need to take the vitals, or to do maybe a dressing change of a wound. Everything you need to do that dressing change, because you don't want to be in the room and like, oh, I forgot the tape, I'll be right back. Like that's like a 10-minute process in itself, just getting everything off, right? Going to find what you need, making sure you've cleaned your hands, everything really, coming back, gearing back up to go back into the room. So you want as much as possible to try and task things and to have everything that you need when you go in that room. And that's really a good rule of thumb anyway, in any room that you go into. So you're not in and out completely all the time or several times. All right, gowns used to prevent soiling of clothes during client contact. That's part of PPE that we can utilize if we know that we're going to be in close proximity or contact to any type of excretions or secretions. Masks are used to protect the nurse from organisms in the client's respiratory tract. So you want to make sure that it fits nice and snugly over your nose and mouth. And when you test for your N95, right, they should be spraying the saccharin. So you shouldn't be tasting any sugary flavors when they're spraying that as you're talking through maybe a passage they're having you read. If you're tasting that, there's a gap somewhere. And you don't want the gap, because if you can taste that, that means other things are getting in there too. Okay, so make sure that fits nice and snug. Let's see, a mask that becomes moistened is ineffective. So it does say change every 1 hour. I mean, that's a good rule of thumb to follow. But definitely if that thing's moistened, like now we're wearing regular surgical masks all the time, right? Whenever we hit the doors of that hospital. So we just need to be cognizant of changing that mask out, especially when it's feeling moistened, because then it's not going to be doing its job. Client wears mask when leaving room for procedure. Yeah, so we got to think about what type of isolation they're on. So if there's any type of respiratory component, we need to make sure we're putting on the appropriate mask on the patient if they have to leave the room, maybe for, let's say they're going to head to surgery or radiology, that it's maybe a radiology test that they can't do there at the bedside, right? So we want to make sure we put the appropriate mask on the patient and a gown over the patient, okay? This should hopefully come to look very familiar to you, right? This is your critical elements for the isolation technique. So you want to make sure that you read through this very thoroughly so you understand the process, but there is going to be a demo day where we'll go through this and demonstrate the process for you. Every single one of your critical elements, if you look at it, what's the first thing it says? Wash your hands, right? Make sure you wash your hands. You need to decide which isolation equipment that you're going to be using before you go into that room. So generally, like maybe for testing day, it might be a room where we tell you you need to go into an isolation room and change a pillowcase and then come back out, right? I will tell you, generally, when we test, the isolation equipment that you're going to need is a regular surgical mask, gloves, and the isolation gown. Okay, those are the 3 things that you'll be using for testing. So those are the 3 things you definitely want to be practicing the order of when you are working in the skills lab. Okay, so you want to put on that gown and making sure the back completely overlaps. You don't want any exposed back as much as you can prevent that. Okay, you want it to completely overlap your back there. Cover your entire uniform. Apply surgical mask or respirator around mouth and nose. So when you put the gown on, you don't want to put the gloves on next and then the mask, right? You put the mask on first, because if you put the gloves on, then you're touching your face and your hair as you're getting that mask on. You have gloves on, you're going to touch the door handle, right? You're going to go touch your patient. So you don't want touching your face and then you're touching your patient. Okay, so mask goes on first and then the gloves. All right. So after you get that surgical mask on, you're going to pull on your gloves, and you want to make sure that the gloves cover the cuff of that isolation gown. Okay. The gloves don't get tucked into the sleeve of the gown. They go over them, right? So you want to make sure you have a clean cuff of that actual gown that's underneath your gloves, so it'll help when you're removing that gown. You're going to go into that isolation room, do whatever nursing task that we give you. When you're coming out, the first thing that you do is untie your waist, okay? So when you first put the gown on, first you want to make sure you're inspecting it, right? You're looking for any holes, rips, tears before you put it on. And you make sure the back is overlapped. You tie the neck, and then you tie the waist, okay? But when you come out, you untie the waist first, okay? What the tie should be behind you or to the side-ish of you, okay? As much behind you as possible. You don't want it in front of you, because you have to take those gloves off to start untying things, right? Especially when you get up to your neck. So you don't want to touch contaminated stuff, right? So make sure you have the tie most behind you, right? So when you come out of that room, that's why you want the cuff underneath the gloves. So you're going to pull the gloves off, and we'll show you how to do it. You can kind of get underneath and pull it and then grab the other one, or kind of pull them into each other. You just don't want your bare hands, touching all the outside of the glove, contaminating you. So once you get those gloves off, that's when you start untying, which is why it's important that tie is behind you, not in front of you, because your gloves are off now, right? You don't want to contaminate your hands. All right, so remove the gloves after you've done that. So untie the neck string. So your gloves are off, right? So you're touching back here near your head. That's why you don't want those gloves on. You're untying those neck ties. And then you just kind of pull it forward and let it drop in front of you. Okay. So after you've done that, you're going to remove your mask after you get that gown off. But you got to remember, so depending on what type of isolation room that you're in, if it's an N95 mask, that mask doesn't come off until you're outside of the room. Okay, because you don't want those little tiny microns getting into your nares and then you're inhaling that. So you would come out and then remove the mask and throw the mask in the trash. If it's just droplet precaution, right, you got to be at least 3 feet away from that patient. So then as you're leaving the room, the mask can come off and then you can, come out. All right, so just be careful with that. I wouldn't even really, if you want to be precautious, all those masks and stuff, the mask component of that can come off when you're out of the room to be safe. That's probably the best practice, to be safe. Okay. Let's see. So once you do that, and once you've done everything, you're always going to make sure you're verbalizing that you're going to go wash your hands when you're testing, and then you always document everything, right? So make sure you're verbalizing that. Wash hands, explain when you're going to be back to the patient, exit the room, and you're going to go document whatever it was that you did in that room. So I have 2 quick videos here for you of a nurse. She kind of demonstrates, goes through it completely wrong and then goes through it right. So you can kind of get an idea of the process. But what you want to do is just make sure for testing that you are following your critical elements in the order that they're stated. Okay. Because that's what you're being tested on. And that's what we're checking as you're testing. So, each place might have their procedure a little bit different, but for the most part, it should kind of follow the same process.
Sam's patient is on contact isolation. She puts on her gown. And gloves. And enters the room.
Sorry. That's fine. Saying weird stuff. I don't know why it's doing that.
Oh, Sam. Sam knows just what to do. She knows that she needs to put on gloves and a gown. The gown should fully cover her torso from neck to knees, arms to the end of the wrists, and wrap around the back. The gown should be fastened at the back of the neck and the waist. Sam performs hand hygiene. Sam knows her gown and her gloves are contaminated. Sam carefully removes her gloves and then carefully unfastens the gown ties, taking care that her sleeves don't contact her body when reaching for the ties. She pulls the gown away from her neck and shoulders, touching the inside of the gown only, and turns the gown inside out while rolling it into a bundle and discarding in the appropriate container. Sam performs hand hygiene. Had Sam had on a disposable gown and gloves, an alternative way to remove the gown and gloves is to do it simultaneously. She grasps the gown in front and pulls away from her body so that the ties break, touching the outside of her gown only with gloved hands. As she is removing,
So I'm gonna tell you that's not a preferred method. There are disposable gowns that have like the perforated where you can break away the neck versus untying. Just make sure you're following the steps of your critical elements. The problem is when you're trying to break away and rip things, you have to be careful how you're jostling that gown because you're flying microbes all over the place. The point is to take it off without disrupting whatever is on it and making it fly everywhere, right? So follow the facility protocols, but when you're testing, you're making sure that you're following the critical element that's currently in there. I think there might be a couple things that order wise that possibly is different than what I have on the slide. I think this might be an older one, but just make sure you're following the critical elements that are in there, okay? And the steps you go, that's what you're going to be actually tested on. But the first gown she had on was one that we actually like preserve, like it goes into linen, a linen. The other one just goes into the trash, which is what you'll pretty much be tested on. I don't know if they still have, there might be some in that drawer that are the ones that we stick in the dirty linen, but for the most part, like testing wise, like what you have in your tote, you should have an isolation gown in there, right? Yeah, that's what you're going to be using, and it should have the ties and not the perforated breakaway. Okay. So there's one more video here. I think this next one gives you a better of, I think they have masks, gloves, everything. Oh wait, that's the same one. Hold on.
These are the steps for donning and doffing PPE. If at any time you feel that you have made an error, please use hand hygiene between any of the steps, or wash any area that has been mistakenly exposed. When donning PPE, begin by checking which PPE is required by reviewing the signage outside the room. To reduce risk of transmission, ensure hair is pulled back and jewelry is removed or minimized. For enhanced airborne droplet contact precautions, start by performing hand hygiene for 15 to 20 seconds. Rub palms, wrists, in between fingers and thumbs, back of hands, and along the nail beds. Alcohol-based sanitizer is the preferred method. Use soap and water when hands are visibly soiled. Don your gown by first closing the back of the neck. Tie the waist, ensuring all clothing is covered. Place your fit-tested N95 mask over your nose and under your chin. Place the top strap at the crown of your head.
So this is good for the N90.
Stretch the bottom strap over your head to the back of your neck. Mold the nose strip to ensure a secure fit and tight seal. Without touching the mask, perform a seal check by placing your hands at the top and bottom while taking deep breaths to feel if any air escapes. If air is felt, readjust mask for proper seal. Don face shield by placing strap at the back of the head, ensuring the shield is resting in the middle of your forehead. Put on gloves one at a time, making sure they are snug over your gown and no skin is exposed. When entering a negative pressure room, ensure each door is securely closed behind you. When doffing your PPE, step into the anteroom, ensuring the door is closed behind you. Remove the first glove by pulling it up and away from the middle of your palm, ensuring no skin contact. Hold glove in the other hand. To remove the second glove, place a finger inside the clean area of the glove and push it off, balling up both gloves together. Throw into the garbage. Remove your gown by first opening at the neck and then at the waist. From the back of the neck, take the gown and slowly pull it out and away from you. Ensure you are only touching the inside of the gown as you roll into a ball and then throw into the garbage.
So you see how she's just not like all, right? So once you get it off, like you get those gloves off, you can kind of, so this is clean basically because your gloves were covering it, right? So I kind of like turtle my hands in like, and then turtle my other one in. And then I can just from the inside, like move my hands where I can just start the glove, just the whole gown just starts coming off. And then I just start rolling away from me, right? And then you throw it in the trash, okay? So I think this one does a pretty good job of explaining a little bit better. I'll let her finish.
Perform hand hygiene for 15 to 20 seconds. Remove the face shield by leaning forward, pulling the strap forward and away from you. Place into the garbage. Remove N95 mask without touching the exterior part of the mask. Again, pull it forward and away from you by starting with the bottom strap and then the top. Place it into the garbage. Perform hand hygiene again. For droplet contact precautions, a procedure mask is required. Follow the same donning procedure for the hand hygiene, gowning, and glove placement. For the procedure mask, place elastics around ears, form to the bridge of the nose, and pull under the chin.
So she's just going through basically the exact same process with a different type of mask, okay? All right, so gloves. So as she showed in the video, you just want to make sure that the cuff, those gloves, it covers the gown, okay? Because it creates that little clean area. So when you're taking everything off, but more so, you don't have an open area where things can drip or get inside there, right? So you want to make sure those wrists are covered and the gown is covered with those gloves. And then the eye protection, okay? So make sure you're following your facility protocol for that as well, depending on if they are requiring eye protection in all the rooms or patient care areas. But she did go over when and how to put that on to don and how to doff them. All right, so delivering care in an isolation room. So be prepared. So it's kind of what I mentioned at the beginning. You just want to make sure you know, first of all, what you're walking into, so you know how to gear up for it, and that you have everything that you need going in that room. So it's not this constant like, oh, I forgot this, I forgot that, I got to go back out. Use precautions to prevent cross-contamination. If all equipment used cannot remain in the room. So the blood pressure cuff, now they're disposable, that can stay in the room. Your stethoscope, now they do have the nice, cute little yellow throwaway ones. I don't know what you're going to hear through that, but they do have them and you can use them. And that could just stay in the room. Otherwise, if you're using your own stethoscope, you need to make sure that you are properly cleaning it as you're exiting that room, okay? Because you don't want to bring any bugs out with you. Your watch, specimen collection, removing protective clothing, and then of course, transporting the client. So we kind of talked about that before. You just need to know what they're on isolation for, so you also know how to dress them for when they need to exit that room to maybe go to another department. All right, so role of the infection control nurse. So this is on page 474 of your text. So this is a nurse who's actually specially trained how to prevent and control infection. They look at all types of things. They look at blood cultures, like what's going on, what's the prevalent pathogen in the hospital right now. They educate staff. They're huge on a huge educational component. So some of their responsibilities: advising hospital personnel in infection control matters, monitoring hospital infections and isolations. Again, they provide staff education, and then writing and reviewing policies and procedures, gathering stats, and then any type of communicable diseases, they actually have to notify the health department. That is their role there within the hospital. All right, any questions? You'll get a whole full demo on how to put the isolation gown on properly, and so how to don and doff in order of your critical elements, okay?